What have you heard about bipolar affective disorder? Welcome to another episode of psychwithoyin. Today we'll be talking about BAD, and it's a fairly common mental illness. It affects about 1 to 2 people in every 100 people. It's a mood swing. That's the simplest term I can use to describe it. So I have a little diagram here to explain exactly what it is. So let's assume that this straight line is normal, and these tiny waves here, it's me and you, assuming that we do not have bipolar affective disorder, while these bigger waves with greater amplitudes, there are people that have bipolar affective disorder. So this normal wave, this straight line is your normal state, you and me. No, we are not sad, we are not happy, we are just there. While these smaller waves is me and you. When we are up, it's when we are happy. When we are down, it's when we are sad. While for people that have bipolar affective disorder, this wave here is when they are either too happy or get too angry too easily. While this one, the downward side, is when they are depressed. Now, in another episode, we'll be talking about depression, but today we are talking about bipolar affective disorder. So people that have bipolar affective disorder, they majorly have mood swings. When you say something small, they get very excited, they jump on the bed, and this response is exaggerated. Or when they're angry, you say something and they get really angry, and before you know it, everybody's fighting and there's a physical altercation. It's accompanied with other symptoms. Sometimes they start, there's loss of inhibition, so they might sleep around, they are at risk of contracting sexually transmitted infections, and then they might say something that they would not usually say. You know, sometimes we have these thoughts in our head and we're able to calibrate and know when to say what. For them, they do not have that. There's loss of inhibition. Then there's increased energy, so they might wake up and rearrange the entire house in a day. Something that would take an average person maybe 3 to 4 days, they might do it in half a day. And then they might take very long distances, so sometimes it's better that they are quickly attended to, because they could also die of physical exhaustion. They can walk from here to, say, Lagos to Abuja. Sometimes they have pressure of speech, so they are saying a lot of words. It's like, I have a million thoughts and I need you to listen to all of my thoughts this moment, so I'm trying to get as many words out as fast as I can. Sometimes they also have poor sleep. What happens is that they sleep for, maybe they sleep 8 hours a day, they sleep for 3 hours and they feel fine. The very next morning they are up and at it again. The treatment is a bit complicated, because usually people that have mental illnesses, there is no cure. It's only treatable, so we try to limit as many episodes as they have. So yeah, what I have explained just now is manic. We call it manic episodes. They can also have depressive episodes, which is why it's bipolar, 2 ends. So we follow the biopsychosocial method. So the treatment is drugs, then psychotherapy, and then social support. So if you have any family member that is dealing with mental illnesses, you should be very emotionally available to support them. So thank you very much for coming to the episode. See you later.